The testicle is held in a prescrotal position and carefully incised so not to cut through the tunic. If unsure if there is another layer above the tunic, move the testicle forward and back. The tunic will move with the testicle. Break away the attachment at the caudal pole of the testicle. This can be quite tough. Tear close to the testicle. The action is like opening a sachet of ketchup. Do not be tempted to cut with scissors. Then strip down the fat. I often anchor the testicle with Alice forceps. Then place a clamp to create a crush bed. I often use Carmalt forceps, they give a better crush bed. Form your Miller knot and then remove the forceps. Slide the knot into the crush bed. Make sure it is super tight so the tunic cannot slip. Follow the Miller knot with 5 to 6 singles. Replace the clamp about 1 cm above the first millers. Form another millers, remove the clamp, and slide the millers into the crush bed. For larger dogs, I place the 2 millers and then place a transfixing ligation. The major vessel and the cord are together, but the muscle and its minor vessel are attached to the tunic. Pass your needle through the muscle, going away from the vessel. Then tie with a surgeon's knot and 5 to 6 ones. The first one after the surgeon's can considerably tighten the surgeon knot. Now place a clamp at least 1 cm past the transfixed knot and remove the testicle. In Denmark, it is considered important to cut in front of the clamp, so not to leave a crush bed in the dog. Check for bleeding, and then nudge the tissue back through the ring. Repeat the procedure for the other testicle. You will have to cut through a smaller amount of tissue to get to the tunic. With this side, I used a normal clamp to anchor the testicle. Again, nudge the tissue back through the tunic. Close the first layer with a continuous pattern. You don't have to worry too much about knot burial. Make sure no fat is caught in the suture pattern. Pick up one side, the middle, and then the other side. Tie with a surgeon's and then continuous to the end. Whether you start at the top or bottom is often dictated by which way we prefer to do our intradermals. If you have any subdermal bleeds, closure of this layer tends to stop any bleeders. Now close the pattern with either surgeon's or Aberdeen knot. Tighten well by spreading your fingers of the first loop. Trim off the tail and then continue into the intradermals. Watch how I pass the needle cranial to the knot and come out in the intradermal position. This hides the knot. Remember, this is not a set rule, as depends on the knot position. I am using the scissors to tighten the pattern, spreading them in the loop of the surgeon's knot. You can close with a surgeon's or Aberdeen knot. I use a surgeon's as it is stronger. If you use an Aberdeen, pass it through twice at the end. This reduces the chance of it falling apart. Try and leave a very small hole for knot burial. Gently wiggle the needle through this hole next to the knot. Lift the skin so it comes out a distance away, which is very important if you are using an Aberdeen. Now gently pull on the suture and push the skin over the knot. Knot burial is essential, otherwise it sits between the skin, and the skin can't heal over the knot. Support the charity and subscribe.